So hopefully you all have that worksheet because this is going to be very much of a workshop. So we're going to be working from that worksheet. So if you don't have it, go ahead and download it and print a copy. So we'll use that as we go through all of it. If you need if you copy and can't find it, just raise your hand or let Muriel know. Yeah, I don't see the link either, Fabio. Muriel, you put it in the chat?
I'm gonna do it again. See if that works.
There it goes. Okay, now we got it.
Oh, wait, what is that?
I don't know. That's it. You get to both.
Ignore my message.
Muriel, do you still need me to post it or did that one work?
Did it work for you, Mike?
Yeah, I see it in two. Yeah, it loaded all the different worksheets, but that's fine. It's the second one, CBF Persuasive Narrative Worksheet is the one you should be downloading.
I apologize for that. That was my Google Drive that I meant to share later. There's a link that Alana shared.
I just put the one to the website. At the end of the training, I'll also just link to the Persuasive Narrative page on the Chamber Provider Fellowship website that has information where you'll be able to access today's presentation, as well as not only this worksheet, but the homework as well. But this should be the link just directly to the worksheet.
Thank you. I thought I was going to be able to copy and paste from the chat.
Just before we get started, can you, or I can share, but if we can just show people what that document looks like.
Of course.
There you go. So that's what, hopefully you have a copy of that in front of you. Have it with pen or paper, pencil ready. We'll be working through this. So we've devised this workshop and the next workshop is very much interactive workshops. You can unmute if you want, because we're going to be presenting a little bit of information, but mostly we're going to be engaging with you guys in a conversation and trying to work you through this whole process of how do you build that persuasive narrative. So this is a good opportunity. Like I said, we're just going to do a quick orientation on some of this information, a little bit of background, and then we're going to dive into actually working collectively on this call through the worksheet. So if you have that, that's great. If not, we'll have the questions as prompts on the PowerPoint, and you can just jot along with us as we go through it. So why don't we take that down and go ahead and get started then, Muriel?
Great. Thank you all. Thank you all for joining us this afternoon. We are on our second of the third Persuasive Narrative workshop. We had one last month on February 3rd. So today we have the Building Your Persuasive Narrative. But very quickly, just as Mike had said, today is more of a workshop. We're just going to go through some information very, very quickly, and then we're going to be more of a hands-on type of workshop that we're going to be doing today. But before we get started, I wanted to just quickly do a reminder of some upcoming events that we are going to be hosting. Wanted to remind you that on Thursday, April 8th, From 9 a.m. to 3 p.m., we will have the Champion Provider Fellowship Mini College creating a roadmap for healthier communities through PSE Change. And then Tuesday, April 27th, we'll have the last of our Persuasive Narrative workshop series. Again, wanted to just quickly, briefly remind you to register for those events if you haven't already. So for today's agenda, what we're going to be doing is, if we wanted to do brief introductions, we'll be going over a brief overview of developing your persuasive narrative. And what that entails is selecting an audience, selecting an action, finding a story that resonates, and then we're going to be providing you with some next steps.
So when we talk about a persuasive narrative, I think what's important is just to remember that this is a use of, I think you can click, Muriel. This is a use of human drama. So we're really looking for that very human way of grabbing people and bringing their attention to the issue that you want to try and persuade them to take a supporting position on. So it's really storytelling with a purpose. And I think the reason we use the envelope is because this is not everything you will be using in a attempt to try and persuade somebody to move forward. It's the door opener. This is what gets their attention. If they're interested enough to open the envelope, there's a lot more information that'll follow. But our problem is we have to get people to actually take a look at the envelope and open up and take a closer look. Okay. When we're developing the persuasive narrative, and we're going to be walking you now through the worksheet, so you can pull your worksheet up because this is we'll follow along. But the first piece of this is to define your audience and action. And this is going to be true. And what we really want to do is make sure today that what you're understanding is how to build a persuasive narrative, what the steps of this are. They're very simple. Most of this is probably so obvious that it feels a little ridiculous to go through it. But I think understanding the format of this makes it a little bit easier. So first you have to understand your audience, and you have to understand what action you want to try and advocate for. Then you have to empathize with that audience and figure out why they believe it's important to connect with you, because this action makes sense to their priorities, not your priorities, but their priorities. And then finally, once you understand that, and we'll go through all of that, then you go into your story development, which is much more of an art than it is a science. And it's something, again, that as dentists and physicians, you have these stories. It's a matter of thinking about these stories and how do we bring them all forward. Okay. Next slide. So when you define your audience, and the first thing that we're looking at, if you look at your worksheet, is defining audiences and actions. And we've offered you a few different prompts of who it might be. So I need you to start thinking about the persuasive narrative and what it is that you want to try and move forward on. What you think would be a place where you can bring people into the right realm and you can start to move them in the right direction to move them forward. But first of all, you have to think about who it is you're influencing, who you want to reach out to and try and persuade. So as we look at this, let's go to the next slide. These are some of the prompts that we offered you. It's in your worksheet here. This is by no means everybody. This is just scratching the surface. But I'd like you all, and again, feel free at this point. I want to be lecturing less and being engaged in more of a conversation. So feel free to unmute yourself and ask questions as you go along when we go through this. But if you think about what it is that you would like to, as a champion provider, you'd really like to advocate for, think about what audience you might want to try and persuade. Now, there may be multiple audiences, and there usually is. There's different people who have different capacities to influence. So feel free to check more than one box if you'd like to, but most importantly, think about that other sector, and who else might be somebody that this is somebody you really want to try and reach out to and try and connect with. So take a look at that, give it some thought, and go ahead and check away here wherever you need to check away, or fill out the different pieces here. Okay, everybody's good? You guys have a sense? I can only see Fadra, and she's shaking her head. So you are the representative for all the fellows today, Fadra. Great. What I'd love to hear is if you guys can just call out some of the different players that that you would like to influence. I'd love to hear some of your different audiences, just because it gives Muriel and myself a better sense of where you're at right now. So I'll let any of you guys chime in. What audience are you specifically interested in reaching out to?
So this is Phaedra. I checked government, city, county, and state, and then healthcare providers.
Okay, very good. And do you have a sense if it's city, county, or state, if it is city, county, or state, who you'd probably want to be trying to influence?
I think at this point, city.
Okay, terrific. Great. That's very good. Vivian, I see you've got policymakers in my county. Great. Anybody else? I'm going to hold you here because I actually need to hear who you're thinking about. Oh, and school administrators as well, Vivian. Okay.
Hi, this is Marie Buell.
Hey, Marie. How are you?
I'm good. So the target audience that I want to reach would be the dental society.
Okay, so societies, good. That's a nice add-on that we didn't have in here, so that's great. I just saw that Tim is looking at local businesses. That's great, Tim. I'm going to be interested to hear how we develop this. I think you can see there's a lot of variety here, and that's actually very valuable, because the important thing and the challenge in communications is there is just no one size fits all. So hearing about these different audiences means we need to be thinking differently about how we develop those messages. Pedro, who do you have?
Yeah, I have nonprofits.
Nonprofits.
Yep, I have the farmers markets. I have also an outdoor organization and then also a health education program that I want to reach and collaborate with them.
Excellent, very good. That should be perfect. Lena, who do you have?
Maybe I would say possibly LAUSD or gosh, it depends what I'm advocating for. Or possibly for county services.
Okay.
Yeah.
Okay, so schools or government. Okay, those are some, and that's a big reach, but that's a good one. Okay, terrific. Lori, sorry.
So I'm trying to reach both city and county government, as
Okay.
well as nonprofits.
Oh, okay, terrific. Good. And Alan?
I'm thinking I'm going to be doing actually a podcast in a couple weeks around arts and health and bringing that to healthcare workers. So I think it's going to be more of a general audience and people interested in arts and health and
okay. Alan, it's great
maybe
to have
administrators.
So it's really important, and this is something that generally comes up. We've really got to discipline ourselves and be careful about thinking in terms of a general audience. So even with a podcast, which will have a general audience, from a persuasive narrative perspective, you need to really know which elements in that audience you need to try and persuade to take a certain direction. So you'll need to segment this to be successful in building out a successful persuasive narrative. And often, and I think, Alan, you bring up a really great point, you're going to use large mediums like the media, for instance, television stations, podcasts, social media. You will use them, and you will you'll have the ability to reach a lot of audiences, but for persuasive narratives, it becomes really important that you have a clear idea of who you want to try and influence in that audience. Again, because one size doesn't fit all. So it doesn't mean that everything you do won't be the same. It just means that you need to think about how you would segment this a little bit better. I hope that makes sense. And there's somebody on here who I can't identify. I've just got a phone number of 530.
That might be Karma.
Oh, okay. That would make sense. All right. Great. So now the next question I'd like to ask you about, you can stay on the slide, but the next question I'd ask you about is, I need you to personify this group that you've now identified. So if it's LAUSD, for instance, I need you to think about an individual inside LAUSD. Now, I don't know if you know somebody, but it's this whole approach is so much easier when we personify it and really think about an individual. Almost inevitably, that individual becomes a marker for a much larger population of other people who are similar to that. But when we think about an individual, it makes it a lot easier for us to try and climb into their mind and trying to empathize what their needs are. So as much as possible, I'd like you guys to look at number 2 and think about the individual or the specific organization that you want to talk to, and take this to this next step. And this is just a refinement of audience. Again, I know it'd be nice to be able to say it's nonprofits in general, but I need you to really, just for this exercise, I need you to hone in on the specific entity that you want to try and address. So if you guys can take a second to write that out, and I'm going to put you all back on the spot again to give me an idea of who it is. Okay, I'm open whenever you guys are. So whoever wants to chime in. Phaedra, I'll let you go. You got to kick it off last time. You get the gold star for that.
So I put specifically the Chula Vista City Council.
Excellent.
I don't know who on the city council though. I got to find out who those city council members are.
No, I get it. At this point, it'd be premature to know. I don't expect you guys to know everybody you will need to be working with, but it's helpful because Chula Vista is going to have a different attitude than, say, another city council. They just are going to see things differently, and it's important for us to understand that, because we can't frame messaging without having a clearer idea of who we're talking about. So that's great. Anybody else out there want to chime in? Oh, good. So Vivian, we've got Moreno Valley and Riverside School Board. Okay, great. Assembly member and House reps for Riverside, and Park and Rec for Riverside. So for this alone, Vivian, can I ask you to choose just one of those for this exercise? Again, I'm promising you, when you develop your persuasive narrative, it will have a broader life than you're thinking. But in order to create it, it's really hard to do if you're too broad. It makes this very challenging. So if you can choose just one of those 3, that would be terrific, knowing that you can go forward. So the school board it is. Good work. Okay, thanks, Vivian. Anybody else? Oh, Marie, okay, the Santa Barbara Ventura County Dental Society, good, which I know you know very well, and that's the key. So the more you know these people, the better shape you're going to be in to be able to develop a narrative that really resonates with them.
I'm thinking about like a healthcare entity, specifically one like Stanford. They have a Well MD program that's looking at physician wellness and well-being. So that's what I'm going to concentrate on.
Very good, Alan. That's perfect. I can't tell you what a difference that makes from going to a general audience to that level of specificity. You'll just find, I hope you'll find this exercise much easier going there. And again, I think what you're going to see is it's going to work. It's going to work for a much broader audience, but you need to get to that base level to move forward. Okay, anybody else? So I'm going to assume then that you guys have all now gotten to a much more specific level that will help us as we move forward through all of this. And we can move on to the next slide then.
So now I believe we're number 3 on the worksheet. We want, what we want to do is really hone in on what do you need to persuade them to do. So you have these checklists here to kind of give you prompts on what you want to think about, how or what type of action you would like for them to take. An example here is, are there steps involved? Is this a coordinated action that requires other participants? So you want to think about all the different aspects of the action that you want them to take.
And you guys probably remember from our messaging that we talked about people are more likely to take a big step if they've first taken a small step. I'm not going to hold you to that here. Right now, this is the big broad picture of what you'd really love to get from the entity, the organization, or the individual, the policymaker. What would you like them to do? And as I said, as Muriel said, these are just some ideas. This becomes really important now, though, because if you're asking them to do 6 different things, they are most likely going to run away from you because you've overwhelmed them. But the other thing they'll do is, of the 6 that you're asking, they inevitably are going to choose the one that you least are excited about. And that means that you've just lost the ability to really direct any kind of conversation or communications with them. You've given it all over to them. So it's more important that you make these decisions instead of giving them a menu to choose from. Now, I am going to need everybody to chime in on this. So I'll be anxious to hear if you guys, I don't know if you know what the answer to this is, but this is a starting point. And if you don't know, take a shot at whatever you think. It'll help us in starting to build this for this workshop as well as the next month's workshop. So who wants to kick us off?
So I can start again.
All right, Pedro, you are the star.
I apparently have some free time today to be on video. It's not often that I can do that. So it's a special day. I'm going to put that I want them to support, endorse, or champion a specific PSE. I have one specific. Do you want to be very specific?
I would love to hear the specific PSE, yeah.
So I want Chula Vista City Council to support the repeal of AB 1163, which is the ban on soda tax in California.
Yeah.
Very good. Excellent. Okay. Now I think what you can see now is we've now gotten to specifics. And this is what we would do with any advocacy work. It's essential that we do it as we build persuasive narratives, because otherwise we're floating out there with lots of conversation about what's wrong with the ban on the soda tax, blah, 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 but we don't really know where we want to go with this. And this helps give us that direction. So perfect. Very well done. Pedro, how about you?
Sorry, I'm trying to eat while I'm I am very bad at multitasking.
So long as you're not drinking a soda.
So, so anyway, what I want to do is I want to have this health education program, and that it deals with obese children, to lead this year a multidisciplinary team with outdoor educators, also with the farmers markets, and the local university, to try to develop a multidisciplinary program in this year. So I need to convince the executive director of the health education program that this is an important task to do. Right now, they're only focusing on obesity education, but I wanted to expand in working in collaboration with party prescriptions and also paid health prescriptions program.
Very good. Boy, I love the specificity of that, Pedro. That's just exactly what we're looking for. Very good. And I think I just saw Vivian chat in. So Vivian's asking local school boards to assist with the creation of PSE project to decrease childhood obesity rates with an incentive program for local hikes and walks with a dock in Riverside. Wow, Vivian, perfect. That's excellent. Just exactly the kind of specificity we're looking for. It makes it so easy when you start thinking about stories now. I can see what's going to resonate from because I've got that level of specificity. Excellent. Very well done. All right. Nina?
I would say probably a specific funding request for a program.
And what is the program?
Well, I think, so to be specific, I think I brought up one idea last time was to create a forum or a place for our population to have some type of physical activity, recreation outlet.
And Lena, remind me, who are you speaking to? Who would be your audience?
So in this case, the audience would be, it depends on what scale. So if it's just regarding my patient population at my clinic, I would be speaking to our CEO and our medical director. If this was on a larger scale, I'd probably be requesting from, LA County, maybe LA County Public Health or.
Okay. Well, let's stick with for today, let's stick with your CEO and the medical director. I think that makes a lot of sense. It's a good place to get your feet wet, see what the responses are before you elevate this up to a higher level. So I think that sounds great.
Thank you.
Okay. Lori?
So I am I'm working on developing my children's outdoor bill of rights, and so I'm struggling to narrow it down. But what I'm thinking for the purposes of this is I want to focus on addressing our Santa Clara County Board of Supervisors and getting them to use their influence and clout to support the Bill of Rights and to help promote it in the community. Excellent. No, that's perfect. That's exactly what I would expect to have on something like this. So this should work quite well. Yeah, good. All right, Lyra?
Hello, everybody. My audience will be the healthcare professionals. I want to talk to healthcare professionals so they will be able to support and encourage lactating families to continue to provide human milk as a very primary resource against food insecurity for their infants.
Good. And I don't know if this will, if we need the refinement, but when we say healthcare professionals, should we be talking pediatricians? Should we be talking about, I'm just trying to tighten that up a little bit.
I think it would begin in the prenatal area,
okay,
which would be OBs as well as pediatricians who are seeing prenatal families.
Perfect. Okay, that's great. That should work well. All right. Marie, what are you advocating for?
Sorry, let me finish chewing.
Oh.
Multitasking. So I'm having a meeting with the Santa Barbara Ventura County Dental Society Board.
Mm-hmm.
So that's the specific group that I need to speak to. And I'm wanting to ask them to take a more active role in the Ventura County Healthcare Improvement Initiative, of which I'm part of right now. However, I feel that without their backing and their participation in this healthcare initiative, the voice that I bring to the table is not going to be as loud. So I need that either that support or having them come in and be part of this committee.
Okay, that's perfect. I think you're in good shape. Good. Tim? You there, Tim? Let's jump on over to Alan then. Alan?
Hi. So I want to persuade them to increase the use of the arts as a tool with their healthcare workers to relieve stress, depression, PTSD, and possibly to bring me on to help advance those priorities.
Oh, great. Okay, and this one's going to resonate really nice. I can't imagine that you won't have some great stories to go with this. Just looking at that, given what everybody's been going through with COVID and isolation and stuff, so it should be perfect. And we have Meredith, it's good to have you on. We have several new players. I don't know, Muriel put in the chat the worksheet that we're using to go across and to address this. So if you guys are ready to chime in, I don't know if you're prepared, Rachel and Emma and Madhu and Meredith, if you're ready to dive in on this or not.
Hi everyone. Hi Mike. No, like you said, I'm just diving in, so I'm very much in a learning mode right now. So I'm gonna need to pass for the moment.
Good enough. That makes perfect sense.
Hi Mike.
Hi.
This is Rachel. Oh, sorry.
Hello, this is Madhu. How are you all?
Very good. How about yourself, Madhu?
Oh, good, thank you. And yes, I wasn't able to attend the first session, but with this one, as far as the PSC goes, I'm trying to collaborate with the Park Service because I had initiated some park signage project, as you probably got some info on. However, incorporating the Parks RX program, and I'm trying to see if we can collaborate with the local nutritionists, either the school-based RDs and or the Diabetes Health Center, which is the primary place that our nutrition help is nutrition help comes from.
Right.
So if there is a way to try and integrate the parks oh, sorry, I see that the video is not on. So if there is a way to try and incorporate that kind of a help in collaborating with the Parks RX program, if there is some suggestion.
Okay. And so what we're trying to do is find out who you need to influence. And would it be the school nutritionists?
The school nutritionist is part of it, but the Park Service people.
Okay, the Park Service. And what would you specifically want the Park Service people to do?
So in getting the Parks RX program going, which I've been issuing, however, there is just because of the coronavirus, because the parks are used for other things, they aren't able to actually get some sort of a cohesive program where the Park Service Director is able to actually promote the use of Parks RX and then give them tours or the docent program going. But if there is a nutrition program where they can have some demonstrations like they used to do before.
Okay.
So that kind of a collaboration, which might actually tie in with the Parks RX, I was thinking.
Good. And I think what's important, Madhu, on this is to really be specific about what you want to achieve. So you've listed a few different things that you'd like them to do. It becomes important in development of these narratives that you choose one thing to start off with. So whether it's the demonstration project or the docent program, whatever it is for Park Service, just think that through and know specifically what you want them to do.
Okay, sounds good.
Great. Rachel or Emma?
Thank you.
Hi, this is Rachel. Hi, Mike, and hi, everyone. Good to see everyone. Sorry, I'm in a space where I can't turn on my camera, so I apologize about
No
that.
problem.
And I am hoping to my target audience would be the health plan of San Mateo, looking specifically for a way to do a pilot project for a pay-for-performance funding source for the county clinics to provide, to prescribe nature therapy. So to continue to expand what we're doing with the nature prescriptions, but then to incentivize providers, even outside of our own system, but that are health plan San Mateo providers, so that we can further incentivize our patients
Wow,
as well.
Rachel, that's fantastic. I love that level of specificity, and I think that should make it very easy as we walk through and start to build out this narrative for you. So great, excellent. And Emma or Tim?
Hi everyone, this is Emma. Sorry for joining late.
No problem, good to have you.
Thank you. I would say that my target audience is the Department of Healthcare Services, and my ask would be that they incorporate our suggested comments to expand their definition of medically supportive food and nutrition beyond medically tailored meals for the Medicaid waiver that will be implemented in this next year.
Great. Wow, that's ambitious, but I know you guys have been doing some great work there. So if anybody can pull it off, it'll be you guys. So.
Thanks.
But it's again, it gives us that specificity. Great. So I don't know if I've missed anybody, or if anybody has any questions about what we're doing here. But again, I think what's really important, what Muriel and I are going to be pushing you towards, is be specific about your audience, be thoughtful, try and picture who they are, but then also really think about the specific thing that you want them to do. It isn't, you know, if I don't want to let you off the hook of just saying fund me. Fund me to do what becomes the important thing. And I think in every case, and this is why I was asking you guys to say these out loud, is it gives me a chance to let you know if it's too broad, if it's too much of a menu, to try and tighten this up and try and move forward. It will make a big difference taking this time. And this is true. We're going to be building out these model persuasive narratives for each of you, and we each will have your own narrative. But why I'm spending some time on this is where we see people generally fall down in developing messaging and narratives, is that they're too broad and they don't have a specific idea of audience, a strong enough and specific idea of who the audience is.
Mike, this is Meredith. Can I add my, I got a chance by listening to everybody else. So can I take a crack at this exercise?
You can go for it, Meredith. Of course you can.
Okay, so for all of us, we know that we just finished listening to the virtual day of action, and we know that the Rethink Your Drink campaigns are up. So I'm trying to apply what we learned in the real world. So for me, what I'm trying to do is I want to reach out to all my collaborative partners to commit to use their influence to grow support for the Rethink Your Drink campaign.
Excellent. That's perfect. That's exactly, again, it's so important that you have the specificity of that audience, because how that would look would be very different for different types of audiences. But because you know who your audience is, you should be able to have a specific idea of what they would actually do if they were playing a more supportive role. So excellent. Very good. All right. So with that, now you have an idea of who your audience is and what you want them to do. Now we move into the next level of all of this, which is to empathize and connect with that audience. So as we do this, we've really got to start thinking, and this is where communications often falls off, is we forget that we're talking to people who are different than us, who see things very differently and have different priorities, and we're frustrated because they don't fold right into what we want them to do. It seems so logical to all of us that this would be the right direction to go, but we need to be thoughtful about what it is that they that really matters to them. So in the context of whatever your ask is, you need to think about why they would see value in moving in that direction. You also are going to need to think about why they would be hesitant to move in that direction. You need to be really honest about this. So at this point now, this is really about empathizing and crawling into their skin, trying to see yourself. If it's the dental board, really trying to climb into how they think. And I can't tell you how important it is to think about why they see the negatives of this as well as the positives. Because if you can identify what's going to, most of us are going to stall out because there's something that we see that just doesn't feel comfortable to us. It's important for you to think those through as well. So that what we're really looking for is to try and get them to accentuate those benefits and overcome those blockades that might be in people's way. And you've got to spend some time thinking about that as we go through all of this. I like that. Yeah, I think Marie just came in with a comment. I need to move them from apathy to engagement. And apathy is usually a demonstration of people feeling overwhelmed, people feeling like they haven't connected with the issue strongly enough, so they don't see the benefit of it all. So it really is just a reflection of what we're talking about. And if you're on your worksheet, then we're going to move to the next item here on empathizing and connecting. These are just some questions that you should be thinking about. You don't have to answer all of these, but I will tell you, the more you can think these through, and please, this is where you can't afford to shortcut this exercise. This becomes really important to spend some time thinking. Most of us think we've got one piece of it and we're ready to go forward, but the more we can do some analysis on this, the more likely we are to be successful in moving through all of this. Some of the questions here are, what are their professional priorities? Whatever entity, individual, or organization you may be working with, there's issues around their job that they have to think about. Will my boss support this? Do we have enough money? Is this a good use of staff time? All of those are some of the questions that are going to come up that you should be thinking through and trying to climb into their skin and think about this. And really be a cynic as you take a look at these questions. But also, what are their professional priorities, and maybe where is the marriage between those professional priorities and what you're talking about? This as a school board, this actually should help address the problems we're having with children not being in the classroom, not being able to pay attention. This may make them better learners. So that matches a professional priority we have. You should also be thinking about what their concerns or threats are. And there are always threats to every action. It is when we talk about change, the resistance to change is always that there's some negative force out there, that this could put me at jeopardy. So think about those and be honest about those as we take a look at it. If you're talking to a funder, remember that not only their professional priorities, but they want to see, they don't want to put a risk of putting funding out there that isn't going to be, that isn't going to have a good response, that isn't going to be sustainable, that they can't take back and have real pride and say, I played a role in the success of that program. And so just as we're talking about threats, the counter to that is, where are the benefits? How are they going to see how this is going to benefit them? The more you can score on this, the better chance you have of winning these folks over. So if you can show them the benefits, again, not the benefits ultimately to your target audience. It's not just about that. They'll see that, you'll be able to pronounce it, but I need you to think about their benefit. How will they benefit by taking on the action that you're asking them to take on? I'm just looking at some of your pieces here, but so if they're going to repeal the ban on the soda tax, how is that going to benefit them? Where will they see that this gives them a leadership position? This demonstrates to their constituency that they're real advocates for health and for children. Whatever the thing is, you really need to think about this from their egotistical perspective. And I'm using egotistical, it's usually used very negatively, but all of us have egos. We need to see that there's a benefit both professionally, but is there a benefit egotistically as well? And then be prepared. Think through all of their arguments as to why they're going to say no. And there will be arguments for saying no. They may never voice them to you, and that's problematic. It'd be great if they did, but the reality is most people don't tell us why they don't want to do it. We have to climb a little bit into their skin to try and think about that. And that allows us to create arguments that unveil those concerns and those issues ahead of time, so that they suddenly those are falling down, even though they may never actually present them to you. But that's part of the game of how you move forward. And then the final question I would ask is, what would they need to know? So what key pieces of information do they need to know? And on that one, I really think I would suggest to you, you need to jot this down. So one of the things we spend a lot of time in persuasive narratives is building this very humanistic, very personal story that helps sell people. But what we never want to ignore is that there's also a data part in people's brains, and that they do need key pieces of information to embrace. So we should be thinking about what would be the elements, what would be the facts and figures that would help them embrace this story and move forward on the persuasive narrative that you're trying to move them forward on. What I want to caution you is think about the key facts that you think are important. Don't bury them with too much facts. Too much is going to take this out of being this narrative that really grabs at their heart and soul. Too little is going to leave them with part of their brain saying, I'm not convinced yet. I don't have the facts I need to be convinced. So 2 or 3 factoids is probably as much as you need to move forward on this in your narrative. Now, if you're successful in your narrative and you're successful in that human side of bringing them to the right place, they're going to start asking you all kinds of factoid questions. They're going to be asking you for more numbers, for more data, for more information. And that's when your persuasive narrative has taken off, because now they're engaged in a conversation with you where they won't be until they feel like there's some emotional buy-in in all of this. Does that make sense? I've got Alana shaking her head. Good move, Alana. I'll take it. I think this is what, from an advocacy perspective, we really have to pay attention to is people come to any argument or any issue that they're going to present with all of their own prejudices and ideas and concerns and fears. We need to think about those and incorporate them into it. And I'm not going to ask you all to go through all of these with us, but I want you guys to think about this. And if there's a homework section, there actually is a homework section, by the way. But before you build out your whole story, I would really suggest that you spend a little time thinking about that specific audience you've identified, the specific ask that you're thinking about, and really giving some thought to these questions and how they would answer those questions. And again, divorce yourself from your idea of why this is so important and try and see it through theirs. Now, in some cases, you may be able to do some quick research and go online if they've taken a position on something like this and be able to read their position. In many cases, this is going to be your best shot at interpretation of what you believe they may be, where they may feel. Ideally, some of you might be able to have conversations with the audience you're talking to and be able to work with them on getting more of an answer to this. You may have colleagues who know these people that you can ask these questions of to get a better sense. But this is the research part of communications that I think most people believe communications is just coming up with a great idea and a great message and delivering it. And the reality is the hardest part of communications is doing this research, really immersing yourself in your audience and understanding who they are and how they move forward. So like I said, I'm not going to take you through all of this, but I'm game if any one of you wants to, we'll just take one example. If any one of you wants to try and pull these up, and Muriel and myself and anybody else on the call can play devil's advocate on how we might respond to some of these. So if any one of you wants to take it on, we'll give you a free communications course here for your bravery of stepping forward. Ah. Okay.
I'll go.
Okay, Marie. So we're going to be the dental board, right?
Yeah, the Dental Society Board.
Okay.
Okay, so what are the professional priorities? So the professional priorities right now is supporting the dentist to remain profitable in light of COVID.
Very good. And I think this is really good. Let's not, sometimes we get too altruistic, and we need to recognize
Right.
that profitability is a reality. If people aren't profitable, they're not continuing to operate. Good.
And then the biggest concerns or threats that I perceive is that the target population to be helped is not their target. So, and then many who have, what I think they're not understanding is that many people who have lost their jobs or are underemployed as a result of COVID have been moved to the Medi-Cal program, including our staff members in the offices.
And that's important because, Marie?
That's important because if we want to have a healthier community would lead to a healthier workforce, and it would mean less downtime and less loss of staff members in our practices, less cancellations with appointments.
Okay, very good. Now
So
you're going to,
yeah, there's
good.
a multitude of benefit. There's a multitude cascade problem that's occurring as a result of the pandemic.
Excellent. This is really good. And I think it's important to start, what you're doing now is you're enumerating where the value is to them in moving forward on this.
Right.
Lost appointments are expensive. Having staff dropouts and staff absenteeism, that's a factor in profitability. All of those make really good sense, and they're worth thinking about. You know, having a healthy workforce, having a healthy population out there should resonate with the dental society. Good.
And then the downside that they might bring up is, and it's the downside that I've been hearing throughout this past 2 years, is that they have PTSD from 2004, when the dental reimbursements were dropped to 10% of the already low reimbursement rates.
Very good. Okay, this is good. And how would you overcome that?
So in order to overcome that is to highlight the effect of the Prop 56 money and all the work that the previous champion provider, dental champion providers, Paul Shao, what they were able to do to increase the reimbursement rates, so much so that for preventative services, the reimbursement for preventative services are at or above the current PPO reimbursement levels.
Oh, okay, great, good, all right.
And now this is where I'm stuck. How do I move them to the next level so that they'll be listening?
Well, let's answer the last question there. What do they need to know?
So
what's important in this argument? What key facts do they need to know?
So with regards to my role in the BC Chic committee, they are setting up a governance team who will make decisions for the county. And what they have, where it is right now is that there will be one representative from each sector, And the representative for the dental sector by default right now is the FQHC that operates in our county. However, they have been glaringly absent in this pandemic on any response. So they have not been participating in any school-based activities. They have not opened their clinics for full services. So the end result is that the patients are seeking care in our offices, which wasn't the case before. So the reason why the Dental Society has to care is because we're going to start seeing these people show up in our offices.
Okay. And that's the important thing to hold on to, is remember that don't get too caught up in the committee hasn't been meeting and so forth. It's the outcome that people are going to be paying attention to. So keep that in front of them.
Right. So they're going to start showing up in our offices, but what the committee is doing is creating a healthcare information exchange that will be extremely burdensome to the private practitioners. As our population ages, where more and more people will be moving, more of the baby boomers are coming of age and now will be moved to state-run programs. We will now be subject to the administrative burden of this healthcare information exchange. So without our input at the ground level, as private practitioners that represents over 1,200 dentists, as opposed to the FQHC that only represents 10 to 12 dentists for the entire county, I feel that it is incumbent upon us to be part of this governance board so that they can hear our concerns and not make decisions for us that we will not be able to change once it's in place.
Okay, good. And I think so one of the things is it's always nice to have a few data points that match your story. So think about that. I don't know that you can say these, but if we don't correct this, we could be looking at a 20% jump in the number of patients in our offices, or we could lose X amount of.
Yeah, we could lose. So I can get the data on that, but we could end up losing these patients that the baby boomer patients that will now move into the public health space.
Right. Which is, and if you could just give us a number of, we've got X amount of baby boomers at that point that we could, those are all at jeopardy. But putting numbers out there helps to solidify this in a lot of people's minds. We have left brains, right brains. We like a balance of the emotional with the data points to try and bring all this forward. Good, you're in great shape there. Marie, that sounds good. And I saw, Madhu, you've got an interesting point here in the chat. I've had some concerns about seeming pushy and re-engaging the park service director with what we began with nutrition and ended due to their working during COVID. I think for all of you, that's always a challenge, is feeling too assertive, too aggressive, and especially not responsive to the overwhelmed situation. And that's, we're going to talk about this actually in our next session when we talk about how to present your creative or your persuasive narrative. So we'll talk a little bit more about that. But the important thing here is, frankly, that you understand that is a big step in the right direction. You're sensitive to that. You need to just bring that forward when you actually engage in those conversations. And you can even open a conversation with, I know you're overwhelmed, and
that is so true. Overwhelmed, both from their perspective, and then when I send an email, there are many times I just save it in drafts because I feel like, oh, I know they're taking on the vaccine follow up from the testing. Now their centers are also doing the vaccines and so on. So, but thank you for addressing that.
Yeah, and again, we'll talk a little bit more about this, so feel free to bring it back up when we get to our next session, because we'll be talking about how you actually introduce this into your persuasive narrative and how you use your persuasive narrative. So, okay, so we've taken a look at some of these issues around connecting with your audience. Hopefully you recognize the importance of doing some thoughtful spending some time and some thoughtful examination of who your audience is and why they care about this issue or why they won't care about this issue or what some of the blocks will be and where the benefits are. With that now, when you finish that, your worksheet now should be a nice touchstone for building out your persuasive narrative as you move forward. We read a persuasive narrative to you last time we got together. We're not gonna ask you to write the narrative, but we wanted to give you a little bit more context of how these narratives look and feel and why they work. So some key issues around a successful narrative is it should be short. So I have to admit, I say about 100 to 250 words. My narratives usually go around 300 words, so I'll give you a little bit more space. But the important thing is we're not trying to write out a big diatribe. It should be something that just you can grab people in a fairly short amount of time, give them a story and get them in there and get them out. If you go too long, people won't be willing to listen. They're looking for a short, interesting story. But mostly people will give you a lot of free room, especially if you're speaking from your own perspective and stories of things that they would recognize as really compelling issues. And speaking of compelling issues, and when we do this, I don't know if you guys remember the story arc we introduced last time, but think about that story arc. Any good story has to give a little bit of background, that's setup. Every good story has some level of crisis in it, some level of problem. The conflict is addressed. So we need to see the problem being presented. That crisis is the apex of your story, and then it moves into some level of resolution. And the resolution is where there's the invitation for them to play a part in that resolution as well. The other elements of a successful persuasive narrative is it needs to be human and personal. We've talked a lot about that. It has to be relevant to your audience, which is exactly why the exercise we just went through is so important. A good narrative should paint a picture. So even though we're trying to economize on words and not have too much going on, we sometimes will jettison things that really matter, things that help paint that picture. And I'll highlight some of those as we go through some of the narratives that we've used in the past. It should also be an invitation to action. So the whole point of the persuasive narrative is that unlike a regular narrative, a persuasive narrative is moving somebody towards some action. And then finally, any good narrative should end with somebody mulling it over and looking at you and asking you a question. If they've asked you a question, your narrative has just invited them to start taking some ownership. And that's the whole point of a persuasive narrative. I'll be honest with you, the persuasive narrative does not end your effort to advocate. It is the beginning of the effort to advocate. It's getting people engaged. And I will tell you that 2 months down the road, when they're still mulling this over, almost inevitably what they come back to is the story you told. And they're like, oh, that's right, I remembered that. And that's where people really become engaged in all of this. Any questions? Okay, why don't we take you into narratives again?
So Mike, I was able to find some data for mine, and it says in 2020 there were 28.6 baby boomers, and well, let me see, where was this? Yeah, there were 28.6 baby boomers, and by 2030, all baby boomers will be age 65 and older and will be participating in government-run healthcare.
Ah, there you go. That's what you wanted. That second point is really the key point. The size and the movement there is great.
And then I feel we need to be participating at the ground level on policies that will be created in the way we will be handling their healthcare in the future.
Absolutely. Great. Good. Meredith has a really great comment in here. Sometimes the interesting narrative can come from people you influence who are willing to repeat the story, and that's absolutely true. I think we talked about this, but the best narratives, people walk away not only convinced, but they actually become your apostles, and they start carrying that story and start moving it forward. So they become real advocates for you, and they will, if the story resonates with them, they will often use the exact same story, however they modify it, because this is what we do as humans. We're all storytellers, and we pass on stories. So Meredith's, and for those of you who don't know Meredith is an amazing advocate. She, I'm certain, can get anything passed by anybody. So she has good sense on all of that. So let's move forward onto the next and take a look at a couple of narratives.
So what we have here are the examples that we had last time. And we're just going to briefly go over it just to kind of show you how, if we present the facts versus telling a persuasive narrative story. So what we have here are some bullet points that we're going to go over real quick. High unemployment, especially in low-paying service sector jobs. Low-income families struggling to pay rent, utilities, bills. Families food insecure, many for the first time. Families stretch budget by buying cheap, typically unhealthy foods, which exacerbate existing chronic health issues. CalFresh underutilized among pandemics, newly impoverished. So these are some bullet points that are often presented to media. And what we have here is a lot of great data points, but how many of you will remember every single one of them?
Or any of them.
That might be true. So now we want to go and look at telling a story. And I'll read this to you with a photo, and I'll share the story later. This is called a provider's perspective. Manny's been my patient for years, a hardworking, dedicated family man, especially proud of his 2 young children. Manny is pre-diabetic, but we've worked together to keep his condition under control. When he came in 5 months ago, however, I was shocked. He looked 10 years older, his sugar levels had spiked, and his spirit seemed broken. Both he and his wife had lost their food service jobs and were worried about eviction. They were stretching their budget by buying cheap processed foods, which was wrecking the careful diet we'd worked out together and left Manny too ill to even look for new work. Manny was too proud to ask for help, but I told him about the CalFresh program. I also reminded him that his health was too valuable to let pride get in the way of seeking help. Last week, Manny was back. He's starting to look like his old self again. He signed up for CalFresh. His family is eating better, and he and his wife had even taken some online nutrition classes. He's still struggling financially, but with a better diet, he has the energy to hunt for new work. I just hope other people who, like Manny, have been devastated by this pandemic will also learn about the government programs that are out there to help.
So again, what we've done is, you saw this last time, but I'm going to show you a couple more examples. But this, what this is doing is, you can see you've got the setup, you've got the crisis, and then you see the resolution and what a resolution looks like. But in the resolution, you can start to see that that there's an action for people to take. So in this case, it's trying to persuade other healthcare professionals to suggest alternatives on ways of helping out people who are in need, especially with food programs, so that they can sign up and take better care, not just of not just what happens in the doctor's office, but doing the preventative work to take care of their health and all of this. So that's a simple narrative. That's a way of introducing people. And I can tell you that the likelihood is people will remember those key points that are important to you if you're advocating for this. And they're going to remember Manny's name. It'll just become something they'll start referring to Manny, because they feel like this is now human. It's at a very personal, human, individual level instead of this big, high level that it's hard to actually, it's too abstract for people to really wrap their arms around. But we wanted to offer you a couple of other examples, and these are from a different program where we've done some different persuasive narratives. But I wanted to introduce these to you because I think that they'll help you start to see how narratives are totally reliant on the work that you just did in the last hour, where you really identified who your audience was, what they care about, what action they need to take, and why that action should resonate with them. So in this case, these are two narratives that we put together for, we were working with Imperial County's health department. Now their audience in this case was physicians. They had created they have what they call the Asthma Community Linkage Program, which is an amazing program, very well funded to be able, Imperial County has some of the highest asthma rates and hospitalization because of asthma rates in the entire country. So they put together this Asthma Community Linkage Program. The problem was they were getting no pickup by doctors. So the providers were not encouraging people, their patients who had asthma, to link into this Asthma Community Linkage Program. And they were really frustrated by this reality and realized, you know, we've tried to talk to them, but we can't get them. They just feel they're too busy to take the time to try and offer this. They don't quite understand it. They're not resonating. So they asked us to help them develop some persuasive narratives that would make doctors start to feel like champions in moving all of this forward. So this is a couple of examples. I'll just read through them. This is Asthma Meets a Class Act. I love teaching. My students always lift my spirits. So you can imagine how hard it is to miss class when my asthma knocks me out of commission. I tried to soldier through and do my best, but it all came to a head a few months ago when I had a bad attack and had to be ambulanced to the emergency room. I don't know what was worse, the attack or seeing the fear in my students' eyes. At the emergency room, they got my asthma under control and told me to get in touch with my provider. All I wanted to do was get back to the classroom, but a fellow teacher told me I couldn't risk putting myself and my students through another trauma again. Dr. Luis has really helped me turn things around. On the spot, he referred me to the asthma community linkages, and they've been wonderful in helping me get my asthma under control. Do you know they even gave me a really expensive Dyson air purifier for my home? What they don't know is that instead it's sitting in my classroom. I figured if the air purifier in the room was contributing to my asthma, maybe the purifier could help my students as well. Dr. Luis got a real kick out of that story when I told him last week. He's so proud of the improvements I've made. I feel like I've got a whole team taking care of me and my students. So again, what you can see now is what we've done is we've turned the doctor into a hero so that when we present this to other doctors, they're starting to see how people's lives are being touched by this and how they're being engaged by all of this work. And hopefully they're going to start to think, I want to be a hero as well. If it's as simple as this and I can have this kind of outcome, that'll be terrific. I'll give you one more example. And these, by the way, were actual stories that we had heard from people that then we could start to build into these narratives. So the incidents that are happening, they're a conglomeration of a few different stories come together to try and make all this happen. So knock it out of the park. My son loves baseball. He'd play it every day of the year if he could, but he can't. His asthma means that I have to keep him indoors on most days, especially when the wind is blowing. It breaks my heart, but Manny has already missed so many days of school, I can't risk him falling behind anymore. I go over to Mexicali to pick up some inhalers and meds for him, but even so, his wheezing is a problem. It got so bad that we had to rush Manny to the emergency room. They took good care of him and told me to get in touch with my provider. I'm not sure what they meant, and I don't have the time to go see a doctor. Besides, Manny was feeling better and my husband picked up some more meds in Mexicali. But then he had another bad attack. This time, some people from the Asthma Community Linkage Program called me and they arranged for a meeting with a doctor. I didn't really think we needed to go, but didn't know what else to do. Thank God for Dr. Templeton. She referred us to ACL and they've really jumped in. They told me how dangerous the drugs I picked up in Mexicali were, and they even arranged for me to get the proper meds at no cost. Manny now has a regular asthma treatment plan, and he's doing great. His grades are up since then, and since he's attending school more regularly. And when we saw Dr. Templeton last week for a follow-up appointment, Manny gave her the winning ball from the baseball game, said she'd earned it as much as winning his winning home run had. So again, it's just very personal. We're getting into the very human side of this, but what we're doing is with a very demonstrative understanding that we're trying to get doctors engaged in this whole referring them to this free asthma community linkage program. And this was in Imperial. You guys all have different situations, but I just wanted to show you that this is what that exercise you've gone through leads to, is an understanding of who the audience is, why they're resistant to it, why would they might embrace it. And we were told very strongly that they do what their other colleagues are telling them makes sense. So that's why we brought actual doctors into the whole equation on all of this. So the challenge for you, as we move forward on all of this, is going to be in actually developing your own narratives that make sense. Now, again, on all three of those narratives, they all had roots in real stories that we had heard. But we took them to another level sometimes because they didn't all have resolutions in place at that point. So what we do is we start to create the resolution based on the solution that you're trying to propagate with the audience you're working with. In some cases, there is an actual resolution, and that's great. But what you all probably have seen is where the conflict is, where the problem is, and where that apex of your arc is going to be. You've seen the challenges and the problems. Alan, I'm thinking of you. I mean, nobody has seen more of where providers are probably overwhelmed at this point and exhausted and really reaching the height of burnout right now and need some kind of resolution to help them. And art might be just the solution. So again, you can see the arc. I think we can all see it. What we want to suggest to you, go ahead, Muriel, to the next slide. What we'd like you guys to do is a homework assignment, and this is an actual homework assignment. We have it, and we'll send it off to you, is start to think about the stories that, again, would match and make sense to the audience you've identified and the opportunities that you want to invite them to start moving toward. So the homework assignment that we're going to give you is to come up with a story. Again, I want to tell you, you don't have to have a resolution to the story. We'll help you manage through all of this. But what we'd like you to do is think of an individual who has benefited from the change that you're proposing. And I don't want you to think of an organization that's benefited. I want you to think of an individual, because we will remember the individual. And I would suggest you name the individual. Even if it's not the real name, you can use a different name for the person. People remember the name and hook on to names. Then the next challenge for you is to describe the situation. So this is that background element, the setup. Describe the situation, the background that's relevant to what you want to try and do with all of this. So think about that. Then I'd like you to take a shot at what challenges did they face. So where's the apex of all this? What did it look like when this reached its worst situation? And this is really what you should be thinking about as you try and develop your story, is what is the problem? What does it look like when this problem is manifested and it isn't resolved? So at its worst situation, what happens at that worst situation? And then start thinking about the resolution that would be the ideal, and how the change you're advocating would lead to that successful resolution. And then ultimately what you want to do is try and see how the target audience would see themselves in the resolution of that role. You can answer these anyway. You do not have to, we're not going to ask you to necessarily write up your story. We're giving you a chance in the form. You can, if you want to take a crack at writing up the story, that's great. If you want to just answer these questions, that's terrific as well. But what we'd like to do is we're going to ask you guys to, each of you, to provide your name and the best contact way of contacting you. And then Muriel and I would like to spend some time going through your worksheet to be able to provide some input so that when we get together at our next session, we can share each other's stories that have been refined at that point, and then talk about how you would actually use that story and execute that story. So we're going to put some time into working with each of you individually on refining this story. I think we've got April, did we have a date on here? April 5th, we'd like you guys to get your drafts back to us. So you guys can take a look at these, start to answer those questions. If you want to take a shot at writing up your story, more power to you. But like I said, what we'll do is then spend some time with you individually and talk through what you've come up with and see if we can help on refining that. And then that will become your platform for the next meeting that we have as we start moving forward. We can share this with each other. You can hear each other's stories, and you can start to see. Then we'll talk about how you use that story in delivery and how you might move all that forward. So, questions or comments about anything that we presented today or about the homework assignment? Hopefully you're not too overwhelmed, but I'm hoping that worksheet that you filled out today should take you right into this next homework assignment, and just walk you through addressing those questions, thinking them through. And if you can answer those questions, you will have built the foundation for a good persuasive narrative. If you have any questions when you're working through this, you can also just contact Muriel if you have a question. Her email's right here. And we'll be happy to get back to you and give you and try and help you answer questions if you get any stuck on any spots. We're more than happy to do that. So when we get together at our next session, like I said, we'll be able to jump right into sharing these stories, and most importantly, talking about now, how do we take that persuasive narrative and actually present it? Because there's lots of different ways of actually presenting and using these narratives.
I have a comment.
Yes.
So I attended the media training, which I think this is a major part of. This is what we did last time. And I found that this worksheet works so much better than the worksheet that we had then.
Okay, good.
Because it breaks it down so that my thoughts are easy, or I can digest my thoughts better, if that makes any sense, you know?
No, I think it makes absolute sense, Maria. I think that's something we've been working on to try and make this a little bit more, break it all out so you can see it. So if once you've answered the questions, hopefully you're well on your way to developing that persuasive narrative.
Right. And then I was able to write it out right now already. Let me read it, and then you can let me know what I need to add.
Well, Marie, can I just ask you to go ahead and send it to us, because I don't want to hold everybody on.
Oh, sure.
But I'll look forward to reading that, Marie. That'll be great. And then we'll work with, as I said, if you guys are willing, we'll be happy to work with each of you. We're going to go through your exercise, make some comments, and if you'd like, we'll be happy to jump on the phone as well and walk through the narratives with you. Because what we'd really love to do is have you all, before we get to the next meeting, feel very confident that you've got a good, strong narrative in front of you. All right. Well, with that, guys, thank you so much. It's been a pleasure, and we will look forward to seeing what you come up with. The next session is April 27th, but your deadline for the next one is April 5th to get these exercises back, so we have enough time to review them and get back in touch with you and refine them. All right.
And these are our contacts. If you guys have any questions, feel free to reach out if you do get stuck. We're here to help. Thanks again for everyone for giving us this time. We know it was longer than usual.
Next one will only be an hour.
All right,
Great,
thanks all.
everybody. Thank you.
Okay, bye.